Hello, classmates and Dr. Antido. Today I'm going to discuss my patient and the endocrine system. My patient's initials are SJ. She's 66 years old, Hispanic descent. She's a widow. So she came in complaining of fatigue, feeling tired with no energy. I only want to sleep. That's what she said. The HPI. So she is a 66-year-old Hispanic female patient who was presented to the clinic by herself. She complains of feeling tired and having no energy to perform her daily activities at home and work. According to the patient, this started 3 months ago, but she thought that it was due to like the weather change, and she said in the last month she's been feeling more tired. Her hair is dry, her skin is dry, and she also gained 15 pounds during 3 months, even when she's eating the same amount of food, and nothing has really changed on her daily activities. She's been doing pretty much the same, eating the same, and is still gained 15 pounds. Another symptom that she complained of is feeling cold, even when other people around her is like comfortable. She is freezing, and she just wants to be under the blankets. According to patient, she has medical history of hypertension and hyperlipidemia, and her current medications are lisinopril 10 milligrams daily. She also takes atorvastatin 20 milligrams PO at bedtime, vitamin C 1,000 milligrams PO daily, and multivitamins 1 capsule PO a day. Allergies, she says no allergies to medications, food, or environmental allergies. Her vaccinations is up to date. She had taken 2 COVID vaccine and 1 booster. She also takes flu shots every year, and the last flu shot she took was in October of this year. Past medical history, she has, like I said, hypertension and hyperlipidemia. No surgical history. She is reproductive system. She is not sexually active, and she's menopausal. At the age of 55, she stopped having her periods. Social history, she's a widow. Like I said, she's still working. She works at Costco and is planning to retire next year. She has a daughter that lives about 10 minutes away from her house, and she is her support system. Also, she denies any alcohol, smoking, or vaping, or use of illicit drugs. Family history, dad died at 75 from kidney complication. Mom, she's still alive. She's 89 years old. Hypertension, arthritis, and GERD. Sister, she's 62, hypertension, kidney issues. Brother, also 64, alive, hypertension. That's all she knows. Maternal grandparents, grandmother died at 79. She had hypertension, kidney issues, and I guess she died from a bleeding ulcer to the stomach bleeding ulcer. Grandfather, deceased at 77 from a fall. Not sure about medical history. Paternal grandparents, grandmother 99-year-old died from kidney disease. Grandfather died at 80 from colon cancer. During the ROS, general reports no fevers and mood disturbances. Reports increase of 15 pounds in the last month. 3 months. That last 3 months. Feeling weak, cold, and tired. Hair. She's complaining of hair feeling thinner and falling off and dry. Denies any head trauma, headaches, lacerations, bumps, or any other problems. Eyes, denies any pain, redness, or blurred vision. Ear, denies any ear problems, loss of hearing, tinnitus, ear pain, or any discharge from the ears. Nose, reports no trouble with her nose, no sneezing or nasal discharge. Throat, denies any pain during swallowing, hoarseness of voice, and any lumps or bumps on her throat. Cardiovascular denies any shortness of breath, palpitations, chest pains, or edema. Respiratory, she denies any chest pain, shortness of breath, or difficulty breathing. GI denies stomach pain, vomiting, diarrhea, or constipation, or blood in the stool. GI denies any problems with urination, and no blood in the urine. Um, Neurological denies any dizziness, paresthesias, any seizures or headaches, or any other problems with neurological, except for feeling weak, feeling tired. Musculoskeletal denies pain or swelling to muscles or joints. Hematology, she denies any easy bruising or bleeding. Lymphatic denies any swollen or sore lymph nodes. Psychiatry denies history of anxiety, depression, or any other mental illness. Endocrinology denies polydipsia, polyuria, heat intolerance, or excessive sweating, but she does report feeling cold all the time and feeling tired and weak. Reproductive system, she reports menopause at 55, so that was 11 years ago. Dermatological, no rash, but she does report dry skin. Allergies, denies any allergies to food, medication, or environmental allergies. Her vital signs today are blood pressure 125/65. She heart rate is 60, respiratory rate is 18, temperature is 97%. 97. I'm sorry, Fahrenheit. Saturation is 98% on room air. No pain. Her weight is 140, and height is 5.1. Physical examination. During the physical examination to her throat, I didn't notice any nodules to the neck, to the trach. Trach is midline, no nodules, no bumps. She doesn't complain of any pain during palpation to the thyroid gland. Cardiovascular and auscultation, her S1, S2 are present, no extra sounds, no murmurs, no palpitation, no edema to the extremities, no chest deformities, no cyanosis. Peripheral pulses are present, +2. Respiratory, chest is symmetrical during respiration, no shortness of breath, no difficulty breathing. Lung sounds are clear to all lobes. GI, abdomen is soft and flat, no palpable masses or lump. Bowel sounds are hypoactive to 4 quadrants. Neurological, patient alert oriented ×4, equal strain to upper and lower extremities. Reflex are intact, +2. Lymph nodes, like I said, they're not swollen. I don't feel any lumps or bumps or any pain during palpation. Endocrinology, hands are cold. Patients wearing sweater. She complains of being cold, and her hands are also cold. No lumps or nodules were felt to the thyroid gland. Skin, there is no rash to the skin. There is no rashes except for being cold and dry skin. For this patient, that was primary diagnosis for hypothyroidism. Thyroid gland helps regulate metabolism in the body, and disruption of the thyroid gland will cause a lot of metabolic dysfunction or irregularities, like in this case of this patient feeling weak, feeling cold, skin is dry, and she also is losing her hair. It can cause all those signs and symptoms. Patient was TSH was 14, free T4 was 2.5, CBC was normal, CMP was normal, with her labs that were done 2 weeks ago. Differential diagnosis can be anemia, can be Hashimoto's disease. In the case of anemia, signs and symptoms of anemia include feeling tired, feeling fatigue, lack of energy, fast heartbeat, Anemia is a low count of healthy blood cells or low red blood count, causing low levels of oxygen in the body to function properly. So that's why it's important to check CBC to make sure that the patient is not anemic and her H&H is not low. Hashimoto's disease is an autoimmune condition characterized by the target destruction of the thyroid gland, and that would be like an autoimmune disease, the body attacking the thyroid gland, and once it's attacked, of course, the thyroid is not going to be able to produce normal levels of the thyroid hormone, causing problems with thyroid and metabolic problems. The patterns of the X chromosome inactivation can be modified by both environmental factors and the composition of the microbiome. This leads to the imbalance in self-tolerance mechanism, resulting in hypothyroidism. Diagnostic testing with this patient, like I said before, TSH, T4, CBC, CMP, CMP to check for electrolytes also, because the patient might be dehydrated and having fatigue, problems with being cold and stuff like that. So it's kind of like another differential diagnosis, I would say. And we want to make sure that the CMP also is normal. Another test to check for thyroid issues can include a thyroid ultrasound, not recommended at this time because we're going to go by the TSH and T4. Also, if we feel nodules on the thyroid, then we want to go ahead and do the ultrasound. If symptoms continue even after treatment with the levothyroxine, that's what we're going to start this patient on. That will be the next step. Will be ultrasound of the thyroid and TBG, which is the thyroid binding globulin, and also auto antibodies to ensure it's not Hashimoto disease. Like I said before, I'm going to start this patient on levothyroxine. Usually, our dose for this will be 1.5 to 1.8 micrograms per kilograms. So that will be the medication for my patient, and she is 140, so 1.5, sorry, let me see, I forgot to do this, 140. 140 divided by 2.2, that gives me 63 times 1.5 equals 95. But according to guidelines, so it would be 95 micrograms for my patient. But since my patient is 66 years old, the guidelines are that for patients that are 60 years old, we need to start with caution, especially if they have heart issues like ischemic heart disease. So we want to start them a lower dose that will be like 50 mics right now, PO daily in the morning. And we're going to check the lab in 8 weeks or 6 to 8 weeks to check those lab and bring it back to normal levels if we need to, and we can start increasing to 12.5 to 25 mics until we get normal levels. If the signs and symptoms continue, we are going to probably refer this patient to an endocrinologist. So all this what I just talked about, my reference, I got it from Annals of the New York Academy of Science, also the American Family Physicians, and National Institute of Diabetes and Digestive and Kidney Disease, and an evidence-based guidelines of etiology, diagnosis, and treatment of Polish Archives of Internal Medicine, thyroid function from the American Thyroid Association. Thank you for listening. That's all for me. Thank you.